Over the past few years, there's been increased awareness of pancreatic cancer. Right now, Jeopardy host Alex Trebek is fighting a public battle with the disease. Researchers are testing a new way to treat the disease that's extending lives, as Shirley Botat explains in HealthWatch.
56,000 Americans are diagnosed with pancreatic cancer every year. It's a cancer that has been historically tough to treat. Now, there's a new treatment when surgery is not an option. 70-year-old Darlene Basola had been intentionally losing weight last year to fight diabetes. But then the mother of 3 and grandmother of 7 became jaundiced. Doctors diagnosed Darlene with inoperable stage 3 pancreatic cancer.
Well, of course, you want to do something that's going to help you along with your family. And then eventually, help others.
Darlene chose to be part of a clinical trial testing a new way of delivering chemotherapy directly to pancreatic tumors.
Good morning, Darlene.
Every other week for 8 weeks, Darlene was wheeled into an operating room at UPMC in Pittsburgh. Doctors treat the tumor using a double balloon catheter called a RenovoCath. Radiologists thread it through the groin into the vessels near the pancreas. They inflate the balloons, then deliver chemo.
We're actually forcing the chemotherapy into the tumor, as opposed to like spraying it on the outside like we would do in the liver.
So far, the trial has shown to extend the lives of some pancreatic patients significantly.
This is huge. This is, we have a patient who's 3 years out, our longest survival at this point.
All my levels are down. I feel great. It needs to be offered to everyone.
For Darlene, married 48 years to her high school sweetheart Terry, it's precious time with the people who mean the most. The trial for the RenovoCath is called Tiger Pack. Researchers are enrolling 300 patients at 30 sites in the U.S. So far, the trial has shown to extend the lives of pancreatic patients from 14 months to 26 months. And that's your Health Watch. I'm Shirley Botat, Local 5 News.